Welcome to my channel. In this video I will discuss G6PD deficiency. G6PD stands for glucose 6-phosphate dehydrogenase deficiency. So it is an X-linked recessive enzymatic disorder. It means that X-linked recessive, it affects males and females are mostly carriers. Females are mostly carriers while males are mostly affected. So when there is G6PD deficiency, it leads to decreased production of this NADPH. When there is decreased production of NADPH, then there is oxidized glutathione present in the cells, and this leads to oxidization of the hemoglobin. And when this oxidized hemoglobin is present in the RBCs, it makes the RBCs more prone to hemolysis. So there is deficiency of NADPH and therefore RBCs become more vulnerable to oxidative stress and therefore hemolysis. There are certain triggers of hemolysis like drugs, sulfa drugs, antimalarials, primaquine, especially primaquine used for Plasmodium. So primaquine is the classic example of antimalarials. Another drug is nitrofurantoin. Certain foods also trigger this G6PD deficiency anemia. These are fava beans, favism, and certain infections can also trigger this hemolysis by increasing the oxidative stress. So main problem is oxidative stress. Now how patient presents to you? These patients present to you with acute hemolytic anemia, and the features of acute hemolytic anemia are jaundice due to increased indirect bilirubin, dark colored urine due to hemoglobinuria, pallor and fatigue. Also, there may be neonatal jaundice in the newborn leading to kernicterus, and in chronic form there is rare case of chronic hemolysis because hemolysis occurs episodically and acutely and then resolves. There are laboratory findings of decreased hemoglobin levels, and the reticulocyte counts are increased because bone marrow is functioning normally. Therefore, reticulocyte count is increased. Indirect bilirubin is increased, as I have told you, because the RBCs when break down, then they release hemoglobin, and hemoglobin leads to formation of this indirect bilirubin. Peripheral smear shows us bite cells. Bite cells are the cells when they are circulating in the blood, then certain macrophages take bite from these cells because these cells contain these Heinz bodies, and Heinz bodies are actually taken by these macrophages. So bite cells are present on peripheral smear. Confirmatory test is G6PD enzyme assay. So it has low activity in G6PD deficiency, but you should take caution when you are taking during the time of hemolysis, because when you are taking during the time of hemolysis, the levels may be falsely normal. So you should not take at the time of hemolysis, but between the hemolytic episodes. How to manage this condition? This condition doesn't require any significant management, but avoid oxidative stress. For example, avoid the drugs that can cause oxidative stress and cause hemolysis in G6PD deficiency anemia. And in case of hemolysis, when there is acute hemolytic episode, then you should go for hydration and transfusion of blood if there is severe hemolysis. But you should remember that mostly patients have HB of more than 8 mg per deciliter even in acute hemolytic episodes of G6PD deficiency anemia. Therefore, these patients don't need transfusion routinely. Treat the underlying infection. If there is infectious cause that is causing oxidative stress, then treat that underlying infection. And when there is neonatal jaundice, then go for phototherapy and exchange transfusion if needed. So this is all about G6PD deficiency anemia.